Good morning, everyone, and welcome to the 10th Annual Patient and Family Gathering for the Erdheim-Chester Disease Global Alliance. Many of you know me. I'm Juvi. I'm part of the Board of Directors for the organization. So it's a pleasure and an honor to welcome you to Barcelona and to the Bellvitge Hospital. Before we start with today's program, I want to make sure that we do some housekeeping things beforehand. Make sure that your earphones are working well. Check that they are functioning. If not, please ask a volunteer at the registration desk. Throughout the hospital, you've seen probably that there are signs for restrooms. Wi-Fi is working. The name of the Wi-Fi is Congresos Bellvitge, and the password I'll be sharing it shortly. Today, we're going to have a series of lectures as well as breaks so we can get together and participate and have fellowship amongst ourselves. In the evening, we'll also have a celebration dinner, so hope you can join us. We will be not only having lectures, the purpose of them is to learn, but also we want to have fellowship. You will hear from leading experts in the diagnosis and management of Erdheim-Chester disease. Through fellowship, you will meet others who understand what it's like living and also caring for an individual living with ECD. And these will be our patients and caregivers, which are the core of the organization. Please ask questions. Don't be shy. Don't believe that asking any question is kind of a burden. Share your thoughts, share your vulnerability. That will make you stronger. And at the end of the day, we hope that you live well-informed, but not just informed with a bunch of medical information, but we want to get you with some information that you can always apply at home, things that you can take and implement in your daily activities, make sure that that information improves your quality of life. But in addition to that, we want you to go home with the most updated information on Erdheim-Chester disease, and we have the privilege of being joined today by world experts in this condition. Lastly, we would like you to remember that the most important thing about today is that you are part of a large family, part of a dynamic group, and that together we will be stronger. This is the password for the Wi-Fi. The Wi-Fi name is Congresos Bellvitge, ECDGA, all uppercases, 2025. It should be working now. If not, please just try to join again and enter the password one more time. It's working? Perfect. With that said, I'm going to pass the baton to our host, Dr. Xavier Solanich from Bellvitge University Hospital, who has some words about Barcelona and the hospital.
Thank you, Julian. It's a great pleasure to welcome you all to the 10th Erdheim-Chester Disease Global Alliance meeting. First of all, I would like to express my sincere thanks to Caitlin Brewer and the rest of organizers for choosing Bellvitge University Hospital as the venue of this important event. Our hospital is located in Barcelona, a vibrant city in the region of Catalonia, Spain. Barcelona has deep historical roots, which you'll be able to appreciate if you get the chance to explore the city in the next few days. From ancient Roman ruins and medieval quarters to the splendor of Catalan modernism, today it thrives as a vibrant cosmopolitan metropolis where tradition and innovation coexist in perfect harmony. This meeting is dedicated to deepening our understanding of Erdheim-Chester disease, a rare and complex condition that continues to challenge the global medical and patient communities alike. My English is not good enough to things. We are truly privileged to have with us today some of the most renowned physicians and researchers in the field of histiocytosis. Your presence brings immense value to this event and reflects your commitment to empowering patients and families by this rare disease. This is not just a meeting, It's a shared journey. Today, patients, families, and healthcare professionals come together with a common purpose: to learn, to connect, and to advance the knowledge that will ultimately lead to better care and improved lives. Your presence here today is proof that you believe that we are all in the same boat, whether you are living with the disease, caring for someone who is, or working on the front lines of research and treatment. Your experience, insight, and voice matter deeply. Let us approach this day with curiosity, humility, and a profound sense of purpose. Collaboration is our greatest strength. Thank you for being part of this important event. Together, we are building a stronger, more informed, and more compassionate community.
Thank you, Javi, for your kind words and for welcoming us all in Barcelona. I'm going to give you a short overview about the organization. Again, I'm Juvianee Estrada. Many people here know me. I used to be a physician working with Erdheim-Chester Disease. I'm no longer do that, but I'm still active in the board of directors in the medical advisory board. I went back to my home or my specialty, which is medical genetics and genomics, but interestingly, even though I'm a pediatrician, I am working for the most part with adults that have cancer predisposition syndromes. So still is very applicable to my field, and I love what I'm doing with the community. So before giving you more overview about the organization, I would like to thank Javi again for inviting us, hosting us, and getting everything ready for us for today. Also, I would like to thank Father Charles Belnaves from Australia. He is the sponsor of the meeting today. Without his commitment and generosity, the meeting will not have been possible. So thank you, Father. Without him, this could not have happened. Finally, we want to thank the planning committee for today's meeting. We met for more, I think, than 8 months every Thursday morning. You can see the names of everyone in the board. It was an interesting meeting because I was thankful that I was in the East Coast of the United States, which is 9 a.m. the time that we did. Paul had to be up at, I don't know, 5 or 6 in the morning. Javi passed his working time, so it was good fellowship. I think I got the best piece out of it, but we all won anyway. You can see their names here in your program. We want to thank everyone who gives so generously their time, their resources, their knowledge. It is truly a global community with everyone contributing to the good for the community. So, but today we're celebrating or hosting the 10th annual ECD conference, but previous to this, there was nothing. Many of you have been with us from the very beginning. Alice, the Hayashidas, they've been with the organization from the very beginning. But all of this started back in 2009, technically. But a group of individuals did meet previous to the organization being created, and this was in 2008. A group of patients and those who loved them found each other on the internet. They discovered they had all similar challenges, similar concerns, and similar questions. They want to understand what was happening with the disease, what was happening to their loved ones, and why no one had any answers. They wanted the best way to treat the disease. They were searching for doctors who might have the answers. They questioned why it took so long for their loved ones to be diagnosed, with some of them receiving diagnosis only after death. Those patients and loved ones began talking, and they began to dream. What will make their situation better? How will they achieve these dreams? They talked to each other about this online. They search for answers, and they search for help. At the urging of medical professionals and those in the rare disease world, they made the decision to organize into an official nonprofit organization. From these humble beginnings, which I've been told it was a kitchen table, the ECD Global Alliance was born. The organization began with thought, if we build it, they will come. There was no funding source, there was no internet part of the pharmaceutical companies, or sorry, interest on the part of the pharmaceutical companies. There was no one in the group who had ever even worked or knew someone that had worked with a rare disease like this one or in the nonprofit world. Yet they embarked into their journey, and here we are celebrating the 10th annual ECD conference. When we compare what we had in 2009, 2010 till now, you can see that those were the dark ages, but not as dark as one would think, because there was a lot of light at the end of the tunnel, and look where we are able to organize and get things in action and come up with goals and build what I call the 4 pillars of the mission of the Global Alliance. 4 pillars which are support, research, education, and awareness. Through support, we're supporting all those affected by Erdheim-Chester disease, no matter how they have been affected, as a patient, as a caregiver, as a medical professional, or any other individual. Through research, we're promoting research efforts to find answers to what causes this disease, how can it be treated, and how can it be cured. Some of those goals, some have been reached in some way or another, so we need to think about the future. What will be the future direction from our research? So for all of you here who are patients and caregivers, we need your input for that. Educating medical professionals about the disease to decrease the time and trauma that comes from long and delayed diagnosis. Many advances have been made in this, with this pillar. However, we still have a lot of work to do. Many doctors still do not understand what a histiocytosis is or what the rare diseases are. I still keep hearing, even in the place where I work, that if it's rare, you likely won't see it in your career, and that's what's making us still have to deal with neglected or unrecognized diseases. Awareness, through raising awareness, so that's all could be better understood, the disease, and help those who have been affected by it. It is a simple mission, one focused on improving the lives of all those affected by Erdheim-Chester disease. It was decided from the beginning of the organization that it will be an inclusive group. Everyone with an interest or need will be welcome into the group. It will be a global organization focused on helping everyone struggling with a question and challenges that ECD brings. Very ambitious, but it happened. This meant that patients, family members, caregivers, medical professionals, scientists, pharmaceutical companies, institutions, etc., will all be welcome to join in helping the organization meet and mission. So many of you are also familiar with that the first case of ECD was described in the 1930s. Now, technically 95 years ago. Since then, we've had significant advancements. Many milestones have been reached. But you see what I'm saying, that the first case was described in 1930, but when we look at the medical literature and the advancements in the understanding of ECD, many things didn't start happening until the 2000s. It took almost the turn of the century before anything was more concise and more developed. So what I want to highlight here is not just necessarily that the ECDGA was founded in 2008, but previous to this, a small group of doctors worldwide were already working with Erdheim-Chester disease. Medical teams in Houston, Texas, in Paris, in Italy, they had already had a vast, robust publication catalog in PubMed. Following this, once the organization was created, that gave a home not only for patients and their loved ones and caregivers, but also for doctors to join and collaborate. And since then, there has been basically a milestone reached almost every year. Of this, the one that it's significantly important, it's in 2016 when ECD was given a classification, where does this disease exist? Previous to that, it was just a name. No one knew exactly if it was a rheumatological disorder, was this an immune disease, was this a genetic disorder, what kind of disorder it was. Some understanding came from research, and it was taxonomized or categorized adequately, and the World Health Organization classified it as a cancer. Following that, now we have 2 FDA-approved treatments and NCCN guidelines plus other guidelines in other literatures that will give information to doctors so they can at least start the workup, understand how these patients manifest, what's the needed treatment, because that's very key. Many doctors do not, will not or not necessarily go where there is a rare condition, when there is no treatment, there's anything that can be done. And all of this has been done, thankfully, to collaboration and understanding about genetics and precision oncology, and many things that have been applied in the world of hematology oncology that was we were able to take it and implement it in ECD thanks to all this characterization that happened in reclassification of the condition. Now the future is to improve health, but how are we going to do that? And hopefully today we're going to have some of that information coming, not necessarily from our panels and from our doctors. They're already doing that work. We also want to hear what the patients and their caregivers would like us to consider. If we do not know about something that's broken, we will not be able to look into it, so we need your help in order to do that. Next, we are seeing, this is from the website, you can see all the patients that have been registered with the organization, and also the care centers. Right now we have 41 care centers throughout the world, and at least as of December 31st, 2024, there was a little bit over 1,000 patients registered with the organization from 75 different countries. As you can see, we have 41 care centers throughout the world, most of them in the United States, in Europe. We still have areas that do not have much representation. As if anyone went to the Seattle meeting last year, someone gave a nice talk and mentioned that there was a desert in one of the areas. So I see that there is a desert still in that area. Only the Seattle Care Center is the one with that has been appointed a care center. So what's going on in that part of the country? But also some other continents, South America, Central America, and Africa, we still do not have a presence there. So if anyone is collaborating with oncology, hematologists, or anyone in those countries, please advocate. Make sure that they know about ECD. Bring them over. Let's start the conversation. And it will be worthwhile to have more of these thoughts. There is a poster in the lobby with this information. So everyone who's here, we encourage you to grab a pen and either put your care center or where you come from, so we can have a representation of how much of the world is present here today. Since forming the organization, there has been a number of programs to support the community. The first row focuses on patients and family immediate needs, which is the patient navigator, online chats, webinars, and annual conferences. The second row will focus on improving the lives of patients and family members through the long term, which is the referral network, research, recruitment and funding, education and awareness. Research funding is very key, very important. Please help us make our funding for research more robust than what it already is. And today, we come together to further our knowledge and to build greater alliances. We hope that you will be able to fully participate in today's session. Please don't be shy. No matter your understanding, your language, your position in the community, your voice matters. Listen and learn what you can. Everyone here has an important story. Ask questions to learn more and ensure understanding. Again, like I said earlier, learn and get information that you can apply to your everyday life. Not just necessarily what drug can I take for this or for that. I know that that's very important, but we also are humans and we want to make sure that our livelihoods, our humanity doesn't go away because we're living with a rare disease. Make new friends. It's sometimes easier said than done, but that's the purpose, make new friends. It can be hard, but everyone is here today, came here with an idea and that they wanted to learn more and engage. Remember, someone has to start the conversation. I'm not telling you that you need to be the one to, but someone has to start it. If someone doesn't start, nothing happens. Offer your ideas. Maybe it will spur a new initiative. Maybe you will learn something. At the very least, you'll have engaged in the conversation and at least your voice has been heard. Finally, be part of the community. We're all here because we believe in the value of community. The more engaged you become, the stronger the community becomes. If you do not know how to be engaged or you have tried and it didn't work, please let us know. We need you to be part of the organization. It's great that we have board members and other volunteers that are very supportive, but it's always good to see new faces working with us. With that said, I'm gonna open up to start our talk for the morning. We're going to have great presentations throughout the morning, including 2 panels. Breaks are in your program, as well as time for a group picture, so please do not go away. Each presenter will have approximately 20 minutes based on the amount of time that the presenter uses. Then we'll have time for questions. I am going to be stopping people from speaking.